Hi, welcome to the 3-minute back pain and posture video. I'm Dr. David Warwick, your local Lacey Olympia chiropractor. Most common ailment that we see is low back pain, and most of us will experience it at one time or another in our life. So if, a lot of times we look at the posture, and that's the main thing that a chiropractor will do is look at their posture and how that affects the position of the bones, the problems that are associated with the intervertebral discs, creating various disc diseases. So let's look, a lot of times when we look at the person from the side, we're actually looking at their lumbar curve or lumbar lordosis. And we want to look at that curve and see how that's affecting the degeneration of the disc, or what we call DDD. This is one of the more common conditions that affect us. And disc diseases, or disc spaces, I should say, there are 5 total discs in the lower back or lumbar spine, 12 in the mid back or thoracic spine, and 6 in the cervical spine or in the neck area. Many times groups or people that have degenerative disc disease overall have a reduction in their curve in the lower back. That means a loss of the curve, or lumbar lordosis curve, which means it's less arch. We found that as a common thing when factor in measuring the low back and seeing the relationship between back pain or back problems and the amount of space or pressure upon that disc area. The reason for the difference in low back degeneration comes from different tissues in the body and low back, and you can feel better. Why is it one person can feel better in one position versus another? Well, the discs act as your shock absorber. It's what gives you your height, especially during the day. When you get in the morning in your car, you have to adjust the mirror and you have to adjust it as night, because we can shrink an inch, inch and a half, even up to 2 inches throughout the day. So those shock absorbers definitely change and affect that. The disc is made of a nucleus, or the center of it, and we call it the nucleus pulposus in there, and it's kind of like a liquid or a disc-like, jelly-like material. The rings around there, or the annulus, or the rings, that's what we call fibrocartilage material. There's many rings, almost like an onion. When you cut an onion, you can see layers upon it, and that's what keeps that disc more into place. Both of those areas are supplied with a lot of nerve and arterial or blood supply to that area, so richly embedded with that, with communication of the nervous system that communicates out from there. But it's also made up of almost 80% water, the disc, and over time that tends to shrink. So why is it that when we have degenerative disc disease, the canals tend to narrow and putting more pressure on the cord, or actually on the nerve roots that exit from the side? And that's why you'll see, like, as you get older, degeneration, why does it feel better to lean forward, maybe over a cart or over a counter, is because it's opening that back area where the cord and the spinal nerves are exiting or coming out from. People that those kind of people will feel better with the lean forward, and it hurts less and they can walk forward when they're in the more of a stoop position. When the disc herniate, it actually feels better to bend backwards to get the pressure off the disc, or pressure off the nucleus or the liquid center. That can even shift the disc a little bit, and that gets pressure away from the nerve root as it exits, and does less pinching on that. And a lot of times when that pinching occurs on the nerve root, it results in the shooting pain or the leg pain that can radiate down either one or both part of your legs. I'm Dr. David Warwick of Warwick Chiropractic in Lacey Olympia, Washington. I hope this information helped. And obviously you have a choice in choosing a healthcare provider for you and your family and friends. Visit my website at drdavidwarwick.com, or give our office a call at 360-951-4504. I hope this was helpful, and I'll see you soon.